think in the City of Buffalo, in partnership with the Buffalo Public Schools, the Erie County Department of Mental Health, philanthropy, and many institutes of higher ed, we've formed a groundbreaking relationship here around mental and behavioral health support for students. We've been able to embed a satellite mental health clinic in each of our 55 Buffalo Public Schools and 7 institutes of higher education, so that students that are having challenges with anxiety, depression, conflict, other tendencies, and need somebody to talk to, have a licensed clinician in their building to go speak to. We think it's a really important part of our portfolio to meet students and families where they are. Whether we're going through a pandemic like we are or in other times, it's always important to have a clinician to be able to go talk to.
Buffalo Public Schools is truly committed to mental health. Through our partnership with Say Yes, the Community Foundation, and UB Department of Psychiatry, we are able to provide continuous service to students in school and in the community. And our goal is to continue to address the social-emotional well-being of every child.
Gateway Longview is a mental health clinic for children ages 3 through 21. Gateway has 2 main clinic locations, one in Buffalo and one in Williamsville. We also have 40 different satellite locations, 11 of which are in Buffalo Public Schools. Our satellite locations allow for our clients to have easier access to mental health services by being located in their schools and different pediatricians across Erie and Niagara County.
So the Community Foundation for Greater Buffalo is guided by 4 overall goals. And one of those goals relates to improving academic achievement and workforce readiness for low-income individuals, low-income households. And each of our goals has a set of leadership initiatives that lives within the goal. And Say Yes Buffalo is one of those initiatives that falls within that educational achievement goal. So the Community Foundation commitment to mental health is really through our partnership with Say Yes Buffalo.
The partnership has been extremely successful. Currently, I supervise the crisis prevention and response team, and we work very closely with Say Yes as well as the UB Department of Psychiatry to be able to provide best practices for our students in school through crisis intervention and prevention, as well as providing community trainings and training for our staff.
One of the innovating, awesome things that's happening right now is telehealth, which is bringing more and more mental health services into the homes of individuals that are suffering from mental health challenges. And it's working. There's many agencies whose show rates have increased, accessibility to families have increased, and I would love to see that carry through post-COVID-19. That a lot of the barriers that kept individuals from accessing mental health services includes transportation, and to be able to connect with your therapist right in your home is a great opportunity to keep that involvement in your own mental health and to doing what it takes to make sure that your mental health is at a good state so that you're able to walk through the daily tasks as normal.
Mental health awareness is important to me because I feel like a lot of people should know that this isn't a game, and it can affect not only the individual, but it can affect your friends and family as well.
Spreading mental health awareness in our communities is a very, very crucial thing. Not only do a lot of people culturally not understand how mental health affects their daily lives, but it's just not talked about enough in our communities.
And I think the key to any service is easy access. And people have a lot of competing interests with their time. People have to work, people have got family obligations, people have school obligations. So it's easy and smart to relocate services where people and students can access them. So I think one of the critical components here was all these partners working together on something they don't have to do by mandate, but that we chose to do to support our kids and families. And a big kudos goes to all of our behavioral health partners in this community, the Child and Family Services, the Gateway Longviews, the Horizons, that have stepped up to offer the service in the public schools. We love co-locating these services right in the Buffalo Public School buildings. So it's been a team approach to this as always, and it's proven to provide great resources and support to students and families through the Say Yes Buffalo partnership.